I'd like to thank you all for joining us this evening. As you may know, War Memorial Hospital holds these education series monthly. War Memorial Hospital is fortunate to have Dr. Alkiek join us last fall. And he's been a Michigan resident for 13 years. He's come
20
to...
years.
How many?
20 years.
Oh, see.
22 years.
Did you see the health feed?
From 92.
Okay.
From 1991.
All right, I apologize. 21 years. He comes to us from a private practice in Grand Blanc. And he also served as the director of non-invasive cardiology at the Genesis Regional Medical Center. He received his medical degree in Syria and relocated to the U.S. to complete his internal medicine internship at Mount Sinai Hospital, an internal medicine residency at Michigan State University, and a cardiology fellowship at Louisiana State University. So without further ado,
Oh, thank you.
Dr.
Thank you.
Alkiek. Thank you.
Thank you for everyone coming. Anyone in medical field, nurses or doctors or anything? Okay. That's good. You know, being giving any lecture, we have to disclose, you know, if we have any commercial relation or anything. I don't have anything. I wish I had, you know. I'm going to show you just before I start, you know, this video. So I have to switch my Apple.
This is your heart. It looks small at first, but it's more powerful than you think. On average, over your lifetime, your heart will beat more than 2.5 billion times. But what is even more impressive are the connections it will make. Because the heart is more than just an organ, it is what allows us to connect to one another. We reach out because we find greater meaning in a life that is shared, and because we know there are questions we can't answer alone. These connections allow us to grow together and fall in love. They teach us to trust and challenge one another. They hold us up and pull us forward. They provide us with enough love to build a family, and they give us the strength to let them go. These connections are the moments that define us. This is our common thread. We reinforce these bonds as we can't imagine life without them. But in reality, we might have to. Heart disease is responsible for 1 in 3 women's deaths, killing more than all forms of cancer combined. It doesn't have to be this way. You can save the women in your life by telling them that heart disease is their #1 killer. Don't be silent. Talk about it. Pass it on as if your life depends on it. Because right now, at this very moment, someone's life does. Who will you tell? Heart disease is no match for the power of women's voices.
As you see from this video, you know, heart disease in women, it is killing more than cancer and other disease. If you look here, this is what, you know, we have heart disease in women, about 366,000. And from stroke, 103 combined, you know, stroke and heart disease, you know, those. But look, lung cancer, about 65%, chronic obstructive COPD, 62,000, and the breast cancer, 42. Usually, so it is very dominant, you know, heart disease, more important than even a breast cancer. In the last century, you know, health care improved, especially after 1950, you know, especially cardiology improved significantly. You know, we have the more invasive testing, more heart catheterization, more open heart surgery, and technology like way ahead of itself. So the woman, it is, you know, become like, you know, equal to the man. So we have to, you know, in the 50, they just shy to come to the doctor, you know, they have nothing wrong with you, just now it is equal. So we would like, you know, the woman to continue that, you know. So you want to know what your symptoms, you know, for stroke and heart attack. What the signs? Generally, is there difference between man and woman? Generally, there is lower prevalence of heart attack in women, but when they come with more severe congestive heart failure, more severe angina when they start having the symptoms. And usually, when we do heart cath, we sometimes see less coronary artery disease. It is more like endothelial disease, like dysfunction artery. So if we do a heart cath for a patient, especially a woman, and they have chest pain, doesn't mean that we don't find the blockages, they don't have a disease. It could be dysfunctional artery. 40% of people, 38.2 million women have heart cardiovascular disease, about 360,000 as mentioned, mortality. So it is high risk. Heart disease and stroke, number 1 and number 3 killer over age 25. It's still young, but still, even with the atherosclerosis the last 30 years, with more obesity and is still dominant. Usually, most of the time, the heart attack started with chest pain in the man. Usually in women, different. It comes with fatigue sometimes. Sometimes, they say, I don't feel good, I don't feel something wrong, I feel like tired, I hear something like fullness in my stomach. So it could be a different symptom from chest pain itself, but if you do have chest pain, it's very important to recognize that, or different symptoms. Sometimes it could be shortness of breath. Shortness of breath is equal to chest pain. Sometimes it could be the jaw pain or neck or back pain between the shoulder. It usually could be blockages. Sometimes increased by exertion, sometimes, especially with women heart disease, emotion is very important. I have many patients who come with a big heart attack, when what we call broken heart. Severe mental stress can cause a spasm in the artery. When they come, there's a big damage, and we do the heart cath, we find no blockages, just a severe spasm. So mental disorder or mental stress, it have big effect in women more than men. So what causing the blockages or the coronary artery disease in women, heart disease? Cholesterol, which is, as you know, soft fat-like substrate found in the blood and all body cells. Usually it increase with age and with other factors. I'm going to talk about it. This is the normal artery, but when we get older, the cholesterol start tilting up and the wall become narrow. Depend what, genetic factor and food factors, what we eat, what we have genetic, if you eat healthy, you have less chance of cholesterol problem. So eating more very good kind of cereal, it usually is help to decrease. People who eat too much fast food, hamburger, they have more chance of blockages, So, generally, the women have smaller coronary artery due to the body size and other factors. And it usually, when the artery become narrow, it causes, angina. When the plaque ruptured or for any reason become like a blood clot or thrombus, and when thrombus form, usually it close the artery, it cause heart attack. And usually when we do angiogram, we found either diffuse blockages or sometimes single blockages here. We put a stent, or sometimes, in this case, we have to just treat medically. Sometimes we cannot, if you have more than one artery, and especially if there's weakness of the heart, we have to do bypass surgery. Generally in the mortality, the older we get, the higher the chance of dying from heart attack or from stroke. Still, compared with the breast cancer, with the colon cancer, all of this, way less. So this still, the coronary artery disease, the stroke is the highest. A lot of information. Even doctors, when we go to medical school, going there's no exit. But usually you start from early and go on, Information available for everyone. We breathe with Google in the morning, and we have Hotmail, YouTube, Facebook, we have a lot of things, So it is available, the information. If the olive oil came from olive, God knows from where coming the baby oil. So what shall we do to prevent heart disease? This is the main lecture, especially none of you in medical field. We have to start, to eat right, as I mentioned, eating more healthy food and more vegetable food, less meat, less especially red meat. We want to be sure, if we are overweight, to lose weight and get moving, by exercise and not to smoke. If diabetic, we have to reduce the blood sugar, and the blood pressure high, we have to take care of it. If the cholesterol high, I'm going to mention one by one, So usually start with good physical every year with your doctors, and be sure your blood pressure, your cholesterol is not high, Second, not to eat anything in the table, You don't want a stomach to be your trash, You want to just eat healthy. Exercise, start from young age, encourage your children and grandchildren to exercise at early age. Now it is mandatory, for the school to have like kids to work at least 35 to 60 minutes a day, workout or gym. So it is what exercise help us to control weight, reducing blood pressure, increase HDL, which is good cholesterol, and to reduce diabetes and another kind of cancer come with diabetes. And psychologically feel better, anyone exercise, have less depression. And you become more self-confident, higher esteem. Usually, as I mentioned, would like children to start from age 2 to work out and, take them to the gym, take them to the park, in the summer to help them, improve. Large analysis showed the reduction in mortality among elderly patients who maintain high level of exercise, including benefit at even up to 93 years old. I have a lady, 99 years old. She come to, she walked 3 miles a day, which is amazing, and she has significant valve disease. If I even have her valve disease, I will not be able to walk. But she's determined, she want to walk 3 miles a day. I'm proud of her. She's, part of this community. You want to exercise, but when you exercise, you increase your appetite. You don't want to eat, more. So watch out, And exercising 30 minutes a day is better than dead to be 24 hours, So it is better to move on, If body smoking, I hope none of you smoking, but if anyone's smoking, you want to quit this habit. It is a habit more than anything else. Because, smoking have a lot of heart issue, It cause lung disease, cause atherosclerosis, and cause peripheral vascular disease. So anyone smoke, it's a good idea to quit. Diabetes, can cause heart disease. So it's very important to talk with your doctor about diabetes, to control it. If you control it, you have less chance of complication, which including atherosclerosis, congestive heart failure, kidney failure, stroke, or blindness. I have many of my patients, they become blind from diabetes. So it's very important to control it. How we control it, eating less sugar stuff, exercise, having good medication, and have what we call hemoglobin A1C, blood sugar every 3 months less than 6.5. It must be, So it's not the end of the world if you are diabetic. We have a lot of people diabetic, so we have to live with it. So talk with your physician about it. Other problem, the weight. Usually higher weight increase atherosclerosis different way. Make you having more sleep apnea, having other issues that causing diabetes. Diabetes causes heart disease. So it's very important to lose weight. Usually we have BMI or basic metabolic index. We'd like it to be less than 25. If it's more than 25, you need to lose the weight. Generally, if it's more than, if it's less than 20, it is underweight. So between 25, 29, it is overweight, obese over 30. So it is very important to lose the weight, besides, to handle the temptation. Like, I have excellent cookies. I love these cookies, But if I have it, I'll probably eat half of it, But usually I stop. Half of it, that's enough, So temptation is very important. Going out, to restaurants, sometimes big portions. Try to share it with your partner. Share it with somebody else. Even take it home second day, because sometimes it helps, So decreasing the amount, serving size, eat slowly, take smaller portion and avoid second. I have a friend of mine, he put like a very good diet program. He's asked to drink a couple of large cup of water before each meal. You will eat less. This is very important and effective, Blood pressure also increase heart disease. We have to control it. Generally, systolic, we like it to list, if it's a patient with pre-hypertension between 120 and 140, we watch them. We advise them to sleep good, exercise, eat less salt, and if it's above 140, we start medication after a few weeks from dieting. And if it's above 180, immediately we have to get, what is called crisis of high blood pressure, because it can cause stroke. So high blood pressure usually increase the heart disease, and so you want to decrease the risk by losing the weight and blood pressure control. Physical activity and heart disease very important. You don't want to be like exercise like fanatic, but at least exercise 30 minutes a day, walking 30 minutes a day, even at older age. Don't give it up. It keep your muscles good. It prevent osteoporosis and help blood pressure to be controlled. It improve the mood. As mentioned, at least 30 minutes a day. So I want to talk about menopause and heart disease, because heart disease increase after menopause. Why? Because estrogen level drop during menopause, blood pressure, bad cholesterol increase after that. So how to prevent heart disease after menopause? Usually get screened. If it's high cholesterol, you're smoking, diabetes, all of this have to be controlled. Exercise regularly, eat healthy diet, and stay positive, because it's very important to stay positive. Don't give up, I want to talk about cardiac rehab, cardiac rehab, especially if I don't know if anyone has stent or bypass. Cardiac rehab, we do exercise program after we do stent or bypass surgery for patient, and it helps the heart to get the heart reset and improve. I'm going to show you a video like 1 minute.
Studies show cardiac rehab can be a lifesaver, but the majority of people who could use it aren't.
The general Medicare guidelines, which most insurances follow, go from heart attack, angina, stent, heart transplant, open heart surgery, which can include the bypass grafts, or valve repair.
That adds up to millions of potential patients. Only 1 in 4 is taking advantage. Registered nurse Alexis Collin works on lifestyle modification.
We want you to not only have the dietary, the exercise benefits, but to maintain your smoking cessation, to control your blood pressure, control your blood cholesterol. When you're with us for up to 12 weeks, we're reinforcing that you're becoming accountable to yourself.
Here's what to expect from a cardiac rehab program like the one at Cape Coral Hospital. You'll begin with an evaluation of your history and medical condition. Go on to a personal treatment plan, get counseling on healthy choices, and take part in supervised exercise.
Oh, yes, it's wonderful to watch them to get stronger, so they feel better, they're doing more, they're able to do more at home. So nothing breeds success like success.
A study from the Mayo Clinic found cardiac graduates were 50% less likely to die 5 years after their heart event. Lowering risk factors while raising fitness levels added up to a change of heart.
That's what we try to get across to them. So we are encouraging them to exercise outside of here, to develop some independence.
And not see you come back here as a patient.
So it's very important, if anyone have like a heart attack, angioplasty, bypass, heart failure, we send them to cardiac rehab. Cardiac rehab, according to Dr. Thomas, from Director of Cardiovascular Heart Clinic at Mayo Clinic, improve the outcome after 5 years. So it's very important, don't give up, Many patients I took care of in 1997 when I came to Grand Blanc area after I finished fellowship. Gentleman, he's 78-year-old, came with a big heart attack. I took him to the cath lab, he said, I want to live, he's alone, I want your help. So I took him, look at angiogram, severe blockages, said, talk with the surgeon, I said, I need you to help this man, fix him. We did open heart surgery. He's 90 years old. I can give you his name, his real estate agent, after like 17 years, I did not give up on this gentleman. So he's still, and he is a friend of mine, my neighbor, he come drink a cup of coffee at my house, I go to his house, So when you have a heart attack, you don't give up, or heart failure, or blockages. If anyone have a question about this program, I'll be glad to answer it, if you have the light on, Go ahead.
For someone with a pacemaker, would cardiac rehabilitation be appropriate for them?
Usually depend what causing the problem with the pacemaker. Is it like sick-sana syndrome or irregular heartbeat atrial fibrillation? Usually it help indirectly, help your heart to get, going. Heart gets smaller when you exercise, and the heart will respond to the pacemaker better than if the heart dilated, if the heart is weak. So it's indirect effect. Usually I still, if the patient have it for real, I send them. Go ahead.
What does get screened mean?
I mean physical every year, at least.
Yeah.
Doing your cholesterol, you doing your, be sure you're not diabetic. High blood pressure is good controlled. And this is from the cardiac point of view. The other screen like breast cancer, you have like mammogram, for colon cancer, if you have family, history, colonoscope, every 5 years.
I just recently have found out that both my brothers have heart disease, so is that then, do you get a stress test? Or
Above, usually if any, for a man above 50, I like them to have stress test, especially if they have risk factor. If they are smoker, high blood pressure, diabetes, they need to have stress test baseline. And if they have,
Did you just men or women too?
This is for the man. For the woman, usually, if they are asymptomatic, no diabetes, no high blood pressure, no, smoking, above 60, because usually the woman, their disease later, come later. 55, 60, they're good to have. But if they have any symptoms like fatigue, shortness of breath, not enough energy, I like them to have stress test. Be sure, they don't have underlying heart disease, which,
Is that your next step after having, if you've done the screening, and then that would be your next step?
Yes, if the patient had family history of heart disease, I like them to have stress test. Like your brother have it, then
And my dad died of it.
it's good to have it. If the strong family history, usually we start even earlier. As I mentioned, the earlier you start, the better outcome. When you're like 35, 40, start cholesterol controlled, exercise, taking good care. I think the outcome way less. Even if somebody have young patient have a heart attack at early age, but when we start taking care of them, risk modification, taking care, stop smoking, exercising, cholesterol low with medication, those patients when they have event, they need to be in medicine. So their outcome is much better if somebody, doesn't take care of him. So,
Thank you.
go ahead.
What does menopause have to do with, increasing women's ability for heart attacks?
As I mentioned, it is decreased the estrogen level, and increasing the high blood pressure with age and other factors, that's what improved. And the last few years, we found giving estrogen increased the breast cancer, so everybody back off from that. That's what other problem, colon cancer, breast cancer, so nobody is. I would recommend, like dietary information like soy. Take too much soy, help like estrogen,
Soy helps the estrogen?
Help, flash, they have the flashes,
Yeah.
Amazing, this is why many of my patients told me that,
What helps? Hot flashes?
Yes, help hot flashes.
Soy.
Soy,
Soy milk or soy products?
either soy product or soy milk, it's better.
Yeah.
It helps somehow.
Dang it, I wish I
I
would
would
have
attest to
known.
that.
No, it is experience, because I have many patients, have many women in my practice. I have over 1,000.
Does having a heart murmur necessarily mean that you're at higher risk for other heart problems?
Depend how, what causing the heart murmur. Sometimes it could be a, squeaky wheel, they call it, loud murmur. Things, doesn't mean bad, But sometimes it could be, we have to have ultrasound, echocardiogram to find out what causes the murmurs, If the murmurs, mild or mild problem, no, does not increase. But if severe, especially with elderly, like aortic stenosis or mitral regurgitation, leaking of the valve, those we have to take care of. Want to be sure the murmur is not caused from heart disease, because if you have a blockage, it can cause your valve to leak the mitral regurgitation. I send many patients to mitral valve repair or replacement due to blockages. So we want to be sure if you have murmurs, not from blockages, not from heart failure, not from, coronary artery disease.
If it started as a baby, it wouldn't be because of blockage then, right?
No, it is a baby, different story. It could be congenital heart disease, which it could be either like a hole inside the heart, ASD, atrial septal defect, or ventricular septal defect, or it could be like sometime like narrowing of the artery, pulmonary stenosis. Okay, so it is, or tetralogy fallow. There's multiple things can cause murmurs in the kids, but 90%, 95%, they will disappear after 2 years. Close, they get better. And the pediatrician tell you from, they will get echocardiogram and they will give you the prognosis, what you have to do. But some people, they have like congenital aortic stenosis. I see them at 20 years old, like 25 years old, Those, the people we would like to watch them, be sure, the valve does not get worse or they don't start passing out or sudden death, So sometimes we change the valve for the murmurs. I have a couple of young patients, they change the valve at younger age, and when they grow up, they grow up more than the valve, we have to do it again every 15, 20 years. This is, when they were like 5 years old, become 20, they need body index bigger, so need bigger valve.
If you just walked 30 minutes, 5 days a week, and just at a vigorous pace, that's exercise when they're talking about that. I know it sounds
Right,
weird.
10 to 50 minutes,
Yeah.
usually 5 to 6 days a week, yeah.
Yeah, okay.
This help a lot, help for especially the woman, osteoporosis, hip fractures, I dealt with it because, the surgeon called me before they take the patient to the surgery. So I see it frequently, especially the elderly, when they don't move, when they fell, they get hip fracture. The people who exercise, they fell, well, nothing happened, because their muscle is good, their bone is good. As exercising 30 minutes is better than taking vitamin D and calcium every day, to be honest with you. So I will encourage anyone, don't give up exercise, don't give up walking, It's very important, Probably, I don't know who's come to the Anytime Fitness, everybody see me. I go like every day, 45 minutes, 50 minutes a day. Because I have to practice what I preach, I cannot tell you, then I go like a coach potato, no. I have to do it,
You mentioned like major emotional events and how those can impact women. What is the impact of like a chronic depression or chronic anxiety or stress?
I'm not sure, I don't know, but usually it is mostly acute things, something, I have like, a lady, she got mad, fought with her daughter for emotional stress, for like 1 hour crying, This is event like harsh event, somebody like lost her son, one of them, it is like very bad emotional stress, So don't let emotional stress her, wash your face, take a break, count 1 to 10, it is, it is very important. This is emotional stress, severe type, it's dangerous. Broken heart, it's Katashobo syndrome, it is well known. It becomes like the tip of the heart become like, like balloon, it's called apical ballooning. Go ahead.
EKG, how much information do you get from when they give you an EKG?
That's maybe the question, EKG, if it's abnormal, great. If it's not abnormal, if it's normal, doesn't mean anything. If abnormal, it's showing, you have something in the gas, But if it's normal, does not mean you don't have disease. So stress tests have to be done.
That's what I was.
Yeah, so it does not yield too much information. Generally, in women, when we do stress tests, we would do like not just treadmill. We would like to do imaging study. We call stress echo or nuclear stress test, cardiolite or Lexis scan stress test. We inject, if we do nuclear or stress echo, we take a picture of the heart by ultrasound before and after stress test. Because EKG a little bit can be abnormal with exercise, even in women, it's called false positive. We used to do too many heart cath in the 80 before we have the imaging, After we have the imaging, we cut down like 70%. So we don't need to do a hard cath, it's a good stress test.
What does stenosis mean?
It is narrowing, in the artery,
Okay.
building up, fatty tissue,
Once it's there, is there a way to get rid of it?
Yes, that's what, there is a Scandinavian study showed people who exercise, who taking care of cholesterol medicine, statin medication, if they are cholesterol high, and they don't smoke, diabetes under control. We did like a cath at the beginning and cath 3 years later, like a regression of disease. We most of, I tell you, this is a great story. A lady came in 1999. She's about 270 pounds. She had angina, I took her to the cath lab. I found she has severe blockage. I said, you need to have bypass surgery. She said, I'm not going to do it. I'm not going to be a fish. That's what she told me. I don't want to be somebody open my chest like a fish. Is there any way? I told her, listen, you go, I want you to do this, right? Give her medication. She danced every day 2 hours. 2 hour dancing. With the music, with activity, She come back and 1.5 years later, she lost over 100 pounds. I cath her again. All the blockage gone.
Oh my God.
I'm telling you, this is my experience, So, taking good care of yourself, to stabilize the problem, delay it years.
Is that the same then with men?
The same, yeah, of course. It is, a Scandinavian study man and woman,
Okay.
It is very important study, So we encourage, people who take statin, they have less chance of heart attack, less chance of, another stent, less have chance of bypass. That's what the statin did, the last 15, 20 years.
But there's a lot of people that can't take statins.
Well, if they can't, they can't, Well, I take it. So if you can't, there's other ways. Eating fish oil, flaxseed, garlic, like vinegar, 1 white teaspoonful vinegar. It's so good, It decreases
Is
your
that cider
cholesterol.
vinegar or white?
White vinegar. It decreases your cholesterol 15-20%.
A teaspoon a day?
It is amazing, So it is very important, healthy stuff, Fish oil, flaxseed, they are very good, It helps,
I'm sorry, you said 1 tablespoon or 1 teaspoon of vinegar?
1 teaspoon.
Teaspoon.
Okay, and it wasn't cider, it's the white one.
I don't know of cider, but I know the study showed, I have many patients, I try, they cannot take statin, I tell them, and I do the cholesterol in a few months, it look like better. It doesn't get me where, what I want, but at least better than nothing.
It helps.
Fresh garlic is good too. I don't know if as long as your husband agree, or you
We'll have to
does
take
not
it too.
sleep, doesn't have to sleep in the same room, If I eat fresh garlic, I will be out of the house,
What is a statin then?
Statin is
Yeah.
medication
Oh,
like
okay.
Lipitor, Sucor,
Oh, okay.
Simvastatin, Crestor. Those medications make big difference in heart disease.
Oh, that's right.
Any patient with the blockages have to be on those medication if the cholesterol above 160, and the bad one, the LDL, low density, low lipoprotein above 70. We have to get this level to 70 or less.
So, because my husband has, he's 10 years older than me, and he has a blockage. One is at 45, and they will operate at 50, where it's at. The other one's at 70, I weigh at 60 or 50, I don't know, and they operate at 70, bypass because he can't be stent. So if he's on Lipitor and exercising for a year, it probably has been helping him.
Oh, it helps a lot,
Yeah, I mean, he's on the highest dosage of Lipitor, I swear they can give him at 122 pounds. But he lost 20 pounds within 3 months, of just changing his diet to
That's
Mediterranean.
very important, yep.
Okay.
But he's tiny.
Oh yeah, it doesn't matter.
Mediterranean
Disease
diet is
doesn't
very
care
good,
the size of you.
I don't know if anyone eats Mediterranean diet, more olive oil, more vegetable,
Yes.
more fresh fruit,
Yeah, that's what we.
This is, more nut,
Yep.
instead of potato chips, or it help a lot,
Yeah, I mean, my husband's 5 foot, 4 or 5, and he never weighed more than 140 pounds. And when they told him he had that, he just couldn't believe it. And he
Genetic and
Yeah,
probably other disorder,
yeah.
high cholesterol.
Yeah, no, it's hard food. Mhm. Interesting, and I don't.
Any other question?
No, I don't.
Well, I hope you have a good month, you know. The
Thank you
month
so
we call
much.
it,
Thank
right?
you.
Thank you.
Very
Very
pleasure.
informative.
And always I'm available, if anyone will stop by, you know, they want any question or anything, I'm available at War Memorial. I work at SU Cardiology at Chippewa Medical Center here at
Okay.
Ashland.
Is
If
that
anyone have a question or concern,
Yeah,
I'd love to.
Dr. Dagny, or?
I do, yeah, I have a clinic with Dr. Dalmia. We help each other. Anyone interested, you know, have a question to sit down, I don't mind, you know, you don't have to, it is free. People who come here tonight, you know, you have like 1 year free consultation.